I would say that pain associated with root canals is always beforehand and not the actual procedure of a root canal. Whether it's a tooth that has a hot nerve or a really inflamed nerve, pulpitis we call it, or a necrotic tooth that has an infection or an abscess, that is generally the negative association with a root canal for a patient. So once the patient's numb and we're able to remove the diseased tissue, the root canal is pretty straightforward and predictable. And it's, for me as a practitioner, root canals are very calming. It's pretty boring for a patient because they're just sitting there with their mouth open. It's just little tiny micro movements and we're just removing any sort of infection in the tooth. And each tooth is different, so it's a different kind of challenge for sure. A root canal saves a tooth because it preserves the actual tooth structure. We're getting rid of the disease, the infection inside the tooth or the toothache. And so if we're able to keep the dental root still there, it's almost as if the tooth is still there and nothing has happened. So a root canal is a great option for a patient that has a big cavity that is really painful, or if the nerve has already died and is infected. We want to remove any sort of infection in the mouth. If I were a patient and I had a tooth that woke me up at night or caused me 10 out of 10 pain, or maybe I chewed on it and I felt a really deep, dull ache deep in the bone, those are a multitude of reasons for having a dental professional evaluate a tooth and possibly needing a root canal to save the tooth. Saving the tooth is great because that gives plenty more years of life out of that individual tooth before considering other options. And then removing infection is always number one priority in not just dentistry, but in medicine and in health. So if we are able to remove the infection in the jaw and in the tooth, that's a great option for the patient.